We are right in the middle of flu season and still fighting against COVID-19. Dr. Rais Vohra, the interim health officer for the Fresno County Department of Public Health, shares the differences and similarities between the two viruses and tells you why it's crucial to get vaccinated for both the flu and COVID-19. We always enjoy our time when we get to speak with Dr. Rais Vohra, and today we are talking about a very important topic, the twindemic, as you called it, because we have the flu and of course COVID-19 still lingers. So doctor, tell me about, as we're entering flu season right now, what do you suspect is going to happen with people as they're still staying protected from COVID-19, but perhaps opening up themselves to getting the flu?
Well, Connie, most people are doing a great job. They've gone ahead and gotten their COVID vaccines. They're wearing masks in the high-risk situations. They're staying safe. And they're staying at home whenever they feel sick, which is all the right thing to do. But we know that with the winter months, our risk of getting infected and passing on infections really goes up because people tend to spend more time indoors, and we know people just tend to get sicker more.
So tell me about the two viruses. Are they the same virus, and what are the similarities and differences between the two?
Great question. So they are different viruses, but they do cause a very similar clinical syndrome. So people may have a spectrum of illness that ranges from just the sniffles and a runny nose, maybe coughing, sneezing, sore throat, all the way to having a full-blown pneumonia, which lands them in the hospital or the ICU, and they may even end up on a ventilator. So flu and COVID can both cause any one of those constellations of syndromes.
Since the flu and COVID-19 have similar symptoms, how do you know if you have the flu or COVID?
Great question. You really just have to go get the test. Okay. So the day that you get sick, or if you've been around someone who tells you that they got diagnosed, then you may have to go get signed up for a test. Okay. I know that that's inconvenient, but there's really no other way to tell. I can't look at a patient and tell you whether they have COVID or influenza or not. There's some things that are a little bit more common with one or the other. So you've probably heard that if you lose your smell or your taste, that equals COVID. That's true for most people, but a lot of different viruses can cause that at least for a few days. So even that is not 100%. It's really important for adults and kids to go ahead and get that flu shot. It's approved for and recommended for every single person over the age of 6 months. You can actually get both your COVID and your flu shot on the very same day. Wow. That's how much freedom you have in terms of scheduling and flexibility. Whatever's convenient for you. If you need to go ahead and get your second COVID dose or even your booster, go ahead and get it, and at the same time, as long as the pharmacy or the clinic has it available, you can get your flu shot that same day. Certainly having two infections at the same time, while it is very unfortunate, could still happen. In fact, it happened last winter. We saw people, just a very few people, that had both influenza and COVID at the same time.
Thank you very much for your time as always. Dr. Rais Vohra, thank you.
Thank you.